Eczema, or also called atopic dermatitis by doctors, is the commonest inflammatory skin condition, affecting around 20% of children and adolescents in the UK, and it usually affects people under 2 years of age. A lot of my patients have had eczema since they were born. Eczema is not just a little bit of itching on the skin. We've known that the sleep is disturbed in eczema for a very long time. If you're itching and scratching during the night, you can't sleep. So a lot of our patients have chronic sleep disturbance, and that starts when the eczema starts, very often under 1 year of age. And you can imagine if you're itching and scratching and not sleeping for many years, that has a profound impact on your quality of life. One of the things that we came across in our clinics, and I look after some of the most severe eczema patients in the country, was how many psychological and psychiatric problems our patients have. For instance, a lot of our patients have got anxiety, depression, they're socially withdrawn. What we are doing in this study, which is quite novel, is that we are taking a modern children's sleep lab into the home environment. We'd like to understand a little bit more how skin inflammation links into sleep disturbance, disrupted body clock, and how that might link in with brain inflammation, all in the quest to understand why so many of our patients have got these severe psychological and psychiatric problems. We've been able to put together a very diverse team of experts. So it's not just me as a children's dermatologist, but we've got experts in children's sleep medicine, the body clock, circadian rhythm. We've got experts from our Institute of Psychiatry, Psychology and Neuroscience. Working in a multidisciplinary team like that is really exciting. All our treatment guidelines talk about the importance of sleep disturbance in eczema, but they don't really give any guidance on how to manage the sleep disturbance. So really this research would like to take us a further step towards managing sleep in a way that is more holistic and really understands the patient and the connections between the skin and the brain.
Hello, my name is Maria, and I am a specialist nurse at St John's Institute of Dermatology. In this short video, I will be explaining why we use paste bandages, and I will show you how to apply them safely. Please note that this is a general guide and should not replace the advice given to you by your doctor or nurse. Paste bandages are cotton bandages that are impregnated with medicated pastes which provide relief from itchy skin conditions such as eczema. Your doctor or nurse may suggest using paste bandages in addition to other prescribed skin creams such as moisturizers or steroids, as placing a bandage over these treatments can make them work better. Paste bandages are non-elastic. The methods of applying the bandages, which I'm about to demonstrate, allow the bandages to expand if there is any limb swelling. Paste bandages can easily stain fabric materials, so it is recommended to use a surface that is easy to clean. You would need to have all the following equipment ready before starting. Paste bandages, they are single use only. Scissors, ideally scissors that have a blunt end. Outer tubular bandage that is measured to cover each limb. This keeps the paste bandage in place and prevents staining to clothing. Emollient, which is pre-poured out, and topical steroids if you have been instructed to do so. Before starting, wash your hands. Clean the area to be bandaged by washing with a soap substitute or as per the advice of your doctor or nurse. Pat the area dry. If you have been directed to use topical steroids under the bandages, apply this to the area affected. There are two common methods used to apply paste bandages. This method will be used to cover one of the upper limbs, starting from the wrists to the shoulder. Start by wrapping the bandage around the front of the wrist and right around the back of the wrist, carefully smoothing the bandage down as you go. The bandage should then be brought back up to the front of the wrist, and once you reach half the width of the first wrap, fold the bandage to create a pleat and continue in the opposite direction, wrapping under the arm, across the top and folding to create the pleat. Each pleat will change the direction that the bandage is being applied. It is important that the folds are created at different places to prevent a single pressure point. Secure the paste bandage in place with a dry tubular bandage. It is important that this fits snug to keep the underlayer in place but is not too tight. You may find this method more suitable if the bandages are applied to smaller areas such as the wrist, ankles or individual fingers and toes. You should start at the base of the toes. Take the bandage around the foot for 1.5 turns, then cut the bandage. Continue doing this until you reach the knee joint, ensuring the overlap is half the width of the previous wrap. If you find the paste bandage is drying out and becoming less comfortable, you can apply a thin layer of an emollient on the outside of the paste bandage. To do this, gently roll the tubular bandage away. Apply a thin layer of a spreadable emollient such as white soft paraffin in liquid paraffin, sometimes known as 50-50, in gentle downward strokes. Then reapply the outer tubular bandage. Paste bandages can stay on for 24 to 48 hours and are not to be reused. To remove the bandage, first roll down the outer tubular layer. Unravel the paste bandages starting from the top of the limb, i.e. the shoulder, if applied on the arms, or the knee if applied to the leg. You will notice the pleats begin unfolding. If you find that the bandages have stuck on the skin, this should not be forcefully removed. We advise soaking the bandages to loosen them, which makes them easier to remove. Thank you for watching. We hope you found this video useful. If you'd like further information, please click on the link below for our downloadable information leaflet.
Hello, my name is Lucy and I'm a specialist nurse at St John's Institute of Dermatology. In this video, I will demonstrate how to apply occlusive dressing safely and effectively. Please note that this is a general guide and should not replace the directions given to you by your doctor or nurse. Occlusive dressings stick to the skin and are used to enhance the effect of some skin creams. The type of dressings we use are called hydrocolloids, and there are many different brands available which come in different sizes. By applying the dressing over your treatment, this keeps it on the skin and increases its absorption, whilst providing a protective layer to prevent any further damage to the skin. Occlusive dressings are often used to make steroid creams more effective. However, using steroids in this way increases their strength and therefore should only be used under occlusion for a short period of time. Occlusive dressings are generally safe to use, however, they should be avoided when the skin is infected, as the infection could worsen. We recommend using occlusive dressings on the torso, arms and legs. Do not use on the face or areas prone to rubbing, such as the groin, under the breasts or arms, or between fingers, as they will not stay in place. Start by ensuring the area of skin is clean and avoid using moisturising creams on the area where you will be applying the dressing, as this will make it difficult to stick to the skin. If the area is hairy, you may need to trim the hairs. Wash your hands. check the expiry date of your dressings. Cut the dressing to size if required, ensuring a 2 cm border larger than the affected area. Apply a thin layer of steroid or your prescribed treatment to the affected area. Remove paper backing and centre the dressing over the area being treated, then smooth out the edges. Press the dressing gently onto the skin for 1 minute to help it to stick. On areas such as the elbows, knees and feet, you may need to cut slits into the dressing to make it easier to put on. We would advise changing the dressing after 24 to 72 hours, but please follow the directions given by your healthcare professional. To remove the dressing, support the surrounding skin with one hand and gently remove the dressing with the other hand. On removing the dressing, you might notice a slight odour, which is likely to be the gelling agent in the dressing. Some dressings or tapes come ready impregnated with steroid medication. Tapes can be used on small areas of skin or cracked eczema on the hands. Follow the instruction on the packet for further advice on application. Occlusive dressings are an excellent way to make your prescribed treatments more effective. We hope you found this video useful. If you would like more detailed information, please download our patient information leaflet.
Hello, my name is Heather and I'm a specialist nurse at St John's Institute of Dermatology. In this short video we will explain and demonstrate how to apply wet wraps to a child as a treatment for eczema. Please note that this is a general guide and should not replace the advice given to you by your doctor or nurse. Wet wraps are made of elasticated material that are used with moisturising creams and other prescribed treatments to calm the skin during eczema flares. They also form a protective layer over the skin and prevent further damage from scratching. Wraps are most commonly used with emollient creams underneath, although they can be used with topical steroids for a short time. You will need the following equipment to wet wrap a large area of skin: 2 tops, 2 leggings, emollient cream, clean warm water in a bowl or sink, and something to distract your child, such as toys or a book. Start by bathing according to the advice you've been given. After a bath or shower, apply a thick layer of emollient to the skin from head to toe. Apply the emollient in downward strokes in the direction of hair growth. While the emollient is absorbing into the skin, prepare the wraps. Put one of the leggings and one of the tops into a bowl of warm water. Once they are fully soaked, remove them and squeeze the garments to remove excess water. The material should feel damp but not be dripping. Make sure that the labels and seams on the garments are worn on the outside of the garment. Roll the sleeves and body sections up. Put the top onto the child by gently stretching the head hole and pulling it over their head. Gradually roll the sleeves and body section down gently. Avoid overstretching the material as it can tear more easily when wet. Then do the same with the leggings. Gather up each leg of the garment and ask the child to step in. Gradually and gently pull each side up until the material is smooth on the legs. Try to do this as quickly as possible so that your child does not get too cold. Once the damp top and legging is on, put a dry top and legging over the top. The garment should be close to the skin but not too tight. You can leave the garments on for up to 24 hours. Most people find that they use wet wraps overnight and remove them in the morning, and use them more during flare-ups. If you think your child has a skin infection, wet wraps should not be used at the same time, as it can make the infection worse. They should also be avoided if the child has a fever or is generally unwell. If steroid creams are applied under wet wraps, this can make them stronger, Therefore, please ensure you carefully follow the advice given by your doctor or specialist nurse. The garments can be washed in the washing machine and reused. The instructions on how to do this come with the garment box. To cover a smaller area of eczema on the arm or leg, tubular bandages may be used instead of full garments. There are different sizes of tubular bandage for the size of area you wish to cover. To use a tubular bandage to wrap a smaller area, follow the same steps as applying a garment, but instead of using a garment, cut 2 pieces the same size from a roll of tubular bandage. Apply emollient to the skin with a steroid cream if you have been advised to do this by your doctor or nurse. Wet the first tubular bandage in the same way you would wet a garment. Apply this to the area being treated, then apply the second dry layer. The tubular bandages are slightly elasticated, so should stay in place, but if they fall down, an additional elasticated bandage or close-fitting clothing may be used to hold it in place. We hope you have found this video helpful. If you would like some further written information, please click on the link below to download a leaflet on how to apply wet wraps.